In today's video, we'll discuss the latest recommendations for managing severe community-acquired pneumonia. These recommendations come from a task force that conducted an extensive review of the literature. Let's get started. Should rapid microbiological techniques be added to current testing for SCAP? Conditional recommendation in favor of multiplex PCR testing when non-standard SCAP antibiotics are prescribed or considered. Benefits are: rapid adjustment of antibiotics, better patient outcomes due to early detection of antibiotic-resistant pathogens. Harms are: additional costs, potential for inappropriate escalation of antibiotics due to false positive PCR results. Can non-invasive mechanical ventilation or high-flow nasal oxygen be used in hypoxemic patients with SCAP? Conditional recommendation for high-flow nasal oxygen, HFNO, instead of standard oxygen for patients not needing immediate intubation. Non-invasive mechanical ventilation might be an option for certain patients with persistent hypoxemic respiratory failure. HFNO benefits are: more comfortable, better oxygenation, lower respiratory rate compared to standard oxygen therapy. NIV benefits are: reduced need for endotracheal intubation. Mortality rates did not vary between patients receiving NIV and those treated conventionally. Should a macrolide or fluoroquinolone be used as part of combination therapy for SCAP? Conditional recommendation for adding macrolides to beta-lactams as empirical antibiotic therapy in hospitalized patients with SCAP. Observational studies showed a significant reduction in mortality and need for ventilatory support in patients treated with macrolides compared to fluoroquinolones. Mortality rates: 19.4% for macrolides vs 26.8% for fluoroquinolones. Odds ratio was 0.68, with 95% confidence interval from 0.49 to 0.94. The p-value was significant. Both fluoroquinolones and macrolides are associated with QT prolongation and cardiotoxicity. Can serum PCT be used to reduce the duration of antibiotic therapy in patients with SCAP? Conditional recommendation for using PCT to reduce the duration of antibiotic treatment in patients with SCAP. PCT has been shown to safely lower the number of days of antibiotic treatment in lower respiratory infections, including CAP. 3 RCTs demonstrated a significantly shorter median duration of antibiotic treatment in the PCT-guided group compared to the control group. Hospital and ICU lengths of stay were not different. Should oseltamivir be added to standard therapy in patients with SCAP and confirmed influenza? Conditional recommendation for using oseltamivir for patients with SCAP due to influenza confirmed by PCR or during influenza season if PCR is not available. A 2014 individual patient data meta-analysis reported reduced mortality in patients treated with oseltamivir or zanamivir compared to non-treated patients, odds ratio of 0.72. Most guidelines recommend oseltamivir for SCAP caused by influenza based on extrapolation of results from different populations, primarily mildly ill, non-hospitalized patients. Do steroids improve outcomes in specific SCAP populations? Conditional recommendation for using corticosteroids in patients with SCAP if shock is present. Data from 6 relevant RCTs were used for this recommendation. Corticosteroids led to a significant reduction in various outcomes such as mortality, shock, septic shock, duration of mechanical ventilation, number of patients on mechanical ventilation, frequency of late treatment failure. Adverse events were similar in relation to corticosteroid use. A 2019 meta-analysis found that adjunctive low-dose corticosteroid was associated with favorable outcomes in SCAP without increasing the risk of adverse events. Does the use of a prediction score for drug-resistant pathogens lead to better outcomes? Conditional recommendation for integrating specific risk factors, computed into clinical scores based on local epidemiology and previous colonization, to guide decisions regarding drug-resistant pathogens and empirical antibiotic prescription in SCAP patients. Several risk factors have been identified for drug resistance and computed into risk prediction models. High sensitivity, low specificity, and high negative predictive values of these models could help avoid broad-spectrum regimens for low-risk patients. 2 risk prediction scores, Maruyama et al. And Webb et al. Showed accurate recommendations without promoting overuse of antibiotics. Do patients with SCAP and aspiration risk factors have better outcomes if treated with a risk-based therapy regimen instead of standard SCAP antibiotics? Ungraded, good practice statement suggesting standard CAP therapy regimen and not specific therapy targeting anaerobic bacteria for patients with SCAP and aspiration risk factors. No data comparing standard therapy and specific therapy targeting anaerobic bacteria for SCAP and suspected aspiration pneumonia. Standard antibiotic regimens, like beta-lactam, beta-lactamase inhibitors, carbapenems, and moxifloxacin, already contain some anti-anaerobic coverage. Studies comparing anti-anaerobic therapy and antibiotics usually used for CAP showed equivalence in effectiveness, but none focused exclusively on SCAP. No evidence to support that standard recommended therapy for SCAP would be less effective than any regimen specifically targeting anaerobes. That's it for our discussion on severe community-acquired pneumonia, SCAP, management recommendations. Remember, these recommendations are based on the best available evidence, but every patient is unique, and clinical judgment should be exercised when making treatment decisions. Stay up to date on the latest research and guidelines for optimal patient care. Thanks for watching.